Fears about the Zika virus are spreading almost as quickly as the disease itself. The World Health Organization is scheduled to hold an emergency meeting tomorrow to address concerns. Earlier this week, the organization's director said the virus is spreading explosively.
The level of alarm is extremely high. We need to get some answers quickly.
The CDC says that there are now 32 cases across a dozen states. Those states include Arkansas, California, Florida, Hawaii, Illinois, Massachusetts, Minnesota, New Jersey, New York, Oregon, Texas, Virginia, and the District of Columbia. According to health officials, 3 cases have been reported in Florida, but not in our area. Those are people who had traveled overseas. So joining us to discuss what you need to know about the Zika virus is Dr. Bhide from the Mayo Clinic. Good morning. Thank you so much for being here.
Thank you for having me.
So do you think that this is an epidemic?
Well, it's not an epidemic in the sense that this virus is not actually spread from person to person. So that at least is the good news. We know that there's a specific kind of mosquito called the Aedes species of mosquito that causes this infection. So what happens is that a person who has the virus, and most people who are infected don't even know they have it. So 80% of people who are infected don't know it. So if they are bit by a mosquito, the blood from an infected person can be kept by the mosquito, and then that mosquito can bite another person, and that's how the infection is spread.
So let's discuss this a little bit more, because a lot of people are wondering, how can they get the Zika virus? And my understanding is if someone is overseas in South America, they get bit by a mosquito with the virus.
Right.
That person from South America travels back to Florida, and then a mosquito bites that infected person that has the virus, and then they get bit by another mosquito is how the virus starts to spread.
Well, so if a person who has the infection is bit by a mosquito, that infection can be carried then by the mosquito to another person. So the important thing is that it's not person-to-person contact. So at least you don't have to worry about that. But many mosquitoes, unfortunately, can carry this virus along with other viruses. And so when you're bit by an mosquito that has this virus, that's how people can get sick.
How concerned should people in Florida be, especially because it is warm down here? And in fact, we've even seen it in some of the northern states where it isn't as warm.
Well, I think potentially, certainly, all of the Gulf states, including Texas, Florida, we are certainly at risk for infections because of our weather and because these type of mosquitoes live in our state. The important things is really mosquito control. So making sure that there's no standing water where a mosquito can grow and lay eggs. Anything around your house, flower pots, garbage cans, anything where standing water can stand. You want to make sure that that's not available. So overturn any of those things in your home. Try to stay indoors. This particular mosquito actually bites both indoors and outdoors, but it doesn't like air conditioning. So if you close the windows, stay in air conditioning, you're much less likely to be bit. It does bite during the daytime, so making sure that you're using a insect repellent, so anything that's approved by the EPA, wearing long sleeves when you're outside so that you're not bit. So at least we have some control over ways to prevent the mosquitoes from biting us.
So clearly, as it gets warmer, you see people being more and more concerned about this virus.
I think that it's just a matter of time that it's going to come to our state, and so I think it's important for us to take measures to prevent mosquito bites and prevent the growth of mosquitoes in our neighborhoods.
Let's talk about microcephaly in pregnant women. Clearly, they should not be traveling to South America. What else do women who are pregnant, what else do they need to know?
Well, if pregnant women are exposed, if they are bit by mosquito and they're in an endemic area, say Brazil or South America, they should seek attention so that they are evaluated, they can be tested, and they can get ultrasounds so their baby can be followed to make sure that they're not developing this brain disorder called microcephaly, where there's problems with brain development and small brains.
And of course, pregnant women certainly do need to be taking precautions to make sure that they are not getting bit by mosquitoes for sure.
Right, exactly.
All right, Dr. Bhide, thank you so much for joining us. There are no medicines to treat those infected with the Zika virus and no vaccines to prevent it, but U.S. officials say that clinical trials on the vaccine could begin this year. Stay with News4JAX as we continue tracking the latest developments with the Zika virus.